Right. Yeah. Good evening again. Welcome to another very interesting segment in the PeMSAA evening talks. So this today we have a group of your seniors who excelled in the recent final MBBS exam, who are very happy and very willing to share their experience. Uh, in their experience, not only in uh, in conducting or in facing the exam, but also how to prepare the exam, how to get yourself ready for your clinical training. Uh, so I think that's a very important segment, and uh, it was very interesting actually organizing this session because we witnessed the level of enthusiasm that your seniors had to share their experience with you. So we know that facing exam, everyone has their different ways of facing exam, the study technique. So that differs from a person to person. So there's no uniform way of facing the exam. So that is why we selected the panel of people, your seniors, who have like different thoughts and different opinions about the way that uh, how you should prepare yourself to become a, to pass your final exam. Not only that, and how to become a good doctor in the future. So without taking much of their time, uh, it's a recorded it's a recorded video. So we will watch the video. Okay.
Hello everyone, welcome to the program A Glimpse into the Clinical Journey organized by PeMSAA. I'm from 13-14 batch and I'm Yasara, this is Nelum. This will be an interactive session where we will be sharing our clinical experiences with you guys so that you will benefit from this. So Nelum, what's the plan today?
So before I'm telling the plan, I must say there is no exact particular way to do clinical. So what are we going to do today is we are going to share our experience, how we did our clinicals, how we did our final exam and all the things we are going to share with you guys so you can grab some important points from that and create your own way to do the clinicals and final exam, and with that successfully face to the final exam and make our mother PeMSAA proud. So what are we going to do today is we are having 8 resource persons from 13-14 batch, Parakrama, Nipuni, Vihanga, Metmal, Sunet, Srividya, Dulini and Hansini. They will share their experience and they will give us proper guide to you guys to do your clinicals well. And also we are having 2 juniors, Dinuka and Ruanare, where they will ask questions from us. These questions are brought by you guys, so they will represent you guys. So we are going to answer their questions and hope this will be a very interactive session and this will be really helpful for your clinical career and do well in final exam. So enjoy it. Let's get started. So Dinuka, what's your first question?
So before starting our session, I would like to thank the PeMSAA and our senior batch for letting us have this golden opportunity. So since they have just done their final exams well, I think it would be a great opportunity for all of us and our junior batches to grasp whatever the successful methods they have adopted and use them and utilize them to succeed in our future exams. So my first question would be, what is the final exam? What is the general format of the final exam?
I think that's a very important question because knowing the general format of the exam will guide you through clinicals and that will be helpful. So we have Parakrama. I think he will give a good account on the general exam format, and then we will talk about pediatrics, genanobs, surgery and medicine, general exam format related to those subjects as well. So we have Sunet, we have Srividya, we have Hansini and we have Parakrama who will be contributing to this. So what do you think, Parakrama? Yes, that's a very important question because knowing the general exam format will guide you through clinicals and make you perform better. So we have several people from our batch who will be good at explaining this to you. So Parakrama will first explain about the general exam format, and then we have Sunet who will be explaining about medicine, and we have Dulini who will be explaining about psychiatry, we have Hansini who will be explaining about genanobs, and then we have Srividya who is willing to explain about surgery. Due to the current situation, Dulini, Srividya and Hansini will be joining us through Zoom. So Parakrama?
Thank you, Asara. In this session, we will talk about how to work in the clinicals. The final goal of you doing the MBBS degree program is to be a competent doctor who is dedicated, kind, empathetic, which will serve the nation. So how you are prepared to that extent is through your clinical training mainly. The final result of your clinical training is evaluated through the final MBBS examination. So while you are starting your clinicals, you should have idea about the final MBBS examination so you can prepare in a better way. So I will tell you about the examination format of the final MBBS examination. The final MBBS examination consists of the theory component and the clinical component. In the theory component for each subject, you have a MCQ paper and a essay paper. In the MCQ paper, there are true false questions and single best answer questions. You will know about the further details later in this session. And in the clinical component, you have short cases and long cases in pediatrics and medicine. And additionally, you have an OSCE and viva in surgery, and there's a gynecology and obstetric OSCE. And in psychiatry, there are MOCIs. In addition to that, you have in-course assessments at the end of each professorial appointment. So you should know about this exam pattern, and you should prepare separately for each component to have a better mark. So you may be a third year, fourth year, or a final year student. So if you are a third year or fourth year, you have an ample of time to prepare for each of these. Even if you are a final year students, still you have got enough time to prepare in a better way to the final MBBS examination. So we will talk separately about each subject, that how to prepare during each clinical appointment, and how to study for this subject. Thank you.
Sunit, would you like to tell us about medicine, the examination part?
Yes. Hello everyone. In medicine examination, out of 100 marks, 80% of marks will be from the final examination, and 20% will be from in-course assessment. We first consider the final examination part. There is a theory component and clinical component, as Parakram mentioned. 40 marks will be from theory component. This theory component consists of MCQ paper and SAQ paper. This MCQ paper, which carries 20 marks, will have 50 MCQs to be answered within 2 hours. Out of these 50 MCQs, 30 will be true and false type MCQs, and the rest of 20 will be of single best answer type. And if you take the essay paper, you get 6 questions with different topics, and you have to answer those 6 questions within 3 hours. So each question will carry 30 minutes duration. Then if we go into the clinical component, which carries 40% of the marks, we'll have a long case which carries 20% and a short case which carries a 20% mark. In the long case, you will get a patient to take the history and examination, do relevant examination within 40 minutes. After this 40 minutes, you will usually have extra about 5 minutes to prepare with the problem list and summary. After this time period, you will face 2 examinations in a viva type interview. In this interview, one external examiner and an internal examiner will listen to your history for 10 minutes. And in the next 10 minutes, there will be a discussion on the case you have. In the short cases, you have 4 systems. For each system, you will get a short case. We have cardiovascular system, respiratory system, abdomen, and nervous system. The nervous system case would be either upper limb examination, a lower limb examination, or cranial nerves. In each short case, you will have 7.5 minutes. Within first 5 minutes, you have to complete the examination, and next 2.5 minutes, you will present your findings, and depending on your findings, the examiners will build up a discussion within 2.5 minutes. That's the clinical component. Thereafter, we go to the in-course assessment. The 20% of marks of this in-course assessment will be taken from 2 case reports you write during the appointment, plus there will be a projected OSCE, plus there will be a small MCQ during the appointment. These 3 components will build up the 20% marks. That is the basic structure of medicine examination.
Parakrama, would you like to give us an account on pediatrics?
Yes, Sarah. Pediatrics is a very interesting subject. You get 3 appointments overall throughout your clinical years, 1 month each. In professorial appointment, you get 7 weeks of appointment. In pediatrics also, as Sunet mentioned, for medicine, there's a theory and clinical component. In theory component, in the MCQ paper, you get 20 true-false questions and 30 single-based answer questions. The true-false questions are based on your theory knowledge, so you have to refer a standard textbook. I personally used illustrated textbook of pediatrics. And for single-based answer questions, you should have a good clinical knowledge. You have seen how the patients are managed in the wards, and also you should have some idea about the clinical guidelines. Then that is about the MCQ paper, and you should focus on this MCQ paper because this will carry marks for your merit list. And for the clinic, and additionally for the theory component, there's an essay paper which consists of 6 essay questions. These essay questions are usually clinical based questions that you will be given a case and asked few questions based on that case. Apart from that, essay questions may be given from the lectures that have been done to you. So I must emphasize that it is very important to attend each clinical lectures that is done by the departments, because then you can clarify your doubts about the subject, and also you can have some idea about the interests of each lecturer, because those areas, there's a high chance that those areas will be asked in the exam. And for the clinical components of pediatric, there's a long case, 2 short cases, and in-course assessment. In the long case, you will get 40 minutes with the patient to take the history, and 10 minutes for the preparation, and 20 minutes discussion for the presentation and discussion both. Within that 20 minutes, it is better you have practiced previously at least to present the case within 5 to 7 minutes. Then you have more time to have a good discussion. And the 2 short cases are given from the different system that you had the long case, because all the 2 short cases and the long case is held on the same day, and you get 10 minutes each for the short case for the examination, presentation and discussion all. And for the preparation of these short cases, especially in pediatrics, I think you have to practice while you are doing the appointments, because handling children is not the same as handling adults. So you should be familiar about how to handle the children during the short cases. Apart from that, you have a in-course assessment which consists of 1 long case and a short case, a viva based on what you have done during the professorial appointment, and also a projected OSCE. That is the examination format of pediatrics. If you are a final year student, while doing the pediatrics appointment is a very organized one, so you will be taught about each of these components, and you can complete your things. And you are lucky if you are in 3rd or 4th years that you have plenty of time to practice according to this format, especially the short and long cases. Thank you.
Yeah, thank you, Sunet and Parakrama. So now we will move on to the our Zoom session. Dolini, Hansini, and is the other one? Srividya, they will join with us with the Zoom to talk about other 3 subjects. So over to
Yes, about the exam setting, there is a theory and a clinical component. In theory, you have MCQs and MCQs. In MCQ paper, you get 20 questions and the single best answer question. Usually these true or false questions are based on theory knowledge. So if you know, you know. But if you don't know, I suggest not to guess. In the exam, actually, in the final exam, I marked 70 statements, but I was 100% sure about those statements because you know you get negative marks if they are wrong. Actually, in SBS, mostly they are based on clinical scenarios. So you have to work in boards to get these answers, and if you have problems, you better to clarify those things in the properly by registrars, senior registrars, or consultant, because they expect the ward management in finally improvement. And SAQs usually will be clinically based, and those are made by our department. So you have to go through the lecture notes to answer SAQs properly. Actually, most of the time I have to go through Madam's books and lecture notes also, but mostly Madam's books. And clinicals, you get 2 cases. 2 long cases, gene case and obs case. And 20 minutes for each for the history therapy. You don't get exact preparation time. It depends. I got actually 15 minutes for my gene case for the preparation. That depends on the time you wait to go to the station. So don't count on that. Just do all the things within those 20 minutes. Okay? You know that in general you don't have short tests. So you have to perform the examination, the relevant examination in front of the examiners. So in gynecology, you have to do abdominal examination, general examination, VP, sputum examination, everything. So sometimes examiners ask to do each and every component. Sometimes you are only asked to do general and abdominal examination, but you will be prepared for everything. So I suggest you to do this just in a few minutes. Do these things during those 20 minutes. Just touch the abdomen and feel if there is an abdominal mass, whether it is ovarian, uterine. So it will be easy. You will be more confident when you are presenting. And also, it's better if you know the presentation live before going in front of the examiners. So it's better. So you don't get you're confident, more confident. And about the marks allocation, you get 40% for the theoretical correctness, MCQ and SAQ both, you get 40%. Then gym case 20%, obs case 20%, and 20% for the OSCE. This OSCE will be held during the final exam, not now. During appointment also, you get mock OSCE, mock clinical examination. But in course assessment, those are not taken. So this is where the OSCE held during the final exam. So for the OSCE, actually Madam's OSCE book, I refer mainly Madam's OSCE book. And if you have problems, you can ask in the ward, senior registrars and registrars. Mainly I focus on the OSCE during the study leave. Actually we had a long study leave, but you can't depend on that. So you better to see all these things also, but mainly focus on the clinicals, theory also. So that's about the exam setting.
Yeah, with regard to the exam format in psychiatry, you have the clinical component, the written component, and the end appointment OSPE. For the end appointment OSPE, you get 10% of marks, and in the clinical component, you have the long case and the mock-E. For the long case, you have 25% of marks, and for the mock-E, you get 15%. And then with regard to the written component, there's the MCQ and the SAQ. For the MCQ, you get 25%, and for the SAQ, you get 25%. So with regard to the merit list preparation, the marks for mocky, the long case and the MCQ will be considered. So we'll take one by one. With regard to the OSPE, some of you might have already done it. The duration will be 10 minutes, conducted at the library. There are 4 questions, video, an audio and a written question and a live one. So you get 10% of marks. So once you go to your finals, you already have 10%. So try to do that well. Then the written component will be done on the 5th day of your written examination. In the morning you have the MCQ component and the evening you have the SAQ part. For the MCQ you have 30 true-false questions and 20 SBA questions. 30 true-false questions, that means there are 150 statements. You get 15% of marks for that, and then for the SBAs you get 10% for the 20 SBAs. Then with regard to the written SAQ component, there are 6 questions. The duration will be 3 hours. For the MCQ, the duration is 2 hours. Then on the SAQs, you get 30 minutes for each question. There are 6, and you have 1 child psychiatric question. So for the preparation of this, it's very important that you have gone through the past SAQ questions. Then we'll move on to the clinical component. You have the long case and the mocky. Both will be conducted on the same day. The long case will be done in the morning and the mocky in the evening. The day you will be doing this will depend on the timetable. Then it will differ from 1 to 1. Then for the long case, you have 30 minutes with your patient. Some of you might get some time prior to going to the patient, so jot down your the sketch of your history and MSc. If you don't get that time, don't get disheartened. I didn't get that time, but if you do, use that time wisely. Then you have 30 minutes with your patient, do your history MSc, and also don't forget the general examination, the relevant physical examination and blood pressure and everything. Then once the 30 minutes is finished, you will be taken over to the department. You have 5 minutes there for the preparation. Try to prepare your summary during that period, and also try to jot down the plan of management, the pathways the discussion can go through. Like quickly think through those stuff, and then once the 5 minutes is finished, you will be taken over for the discussion. You have 15 minutes there. There's an internal examiner and an external examiner. One will take the history from you, and they will prompt you to quickly get there to quickly complete your history and MSc presentation, because you need time for your discussion. Then that's it for the long case. Then with regard to the mocky, there are 2 mockies. There's a simulated patient and 2 examiners. The duration would be 8 minutes. You have to talk to the patient for 7 minutes, and the examiners will observe you. There won't be introduction with them initially. Then at the end of the 7 minutes, a bell will be rung and they will ask a question from you, which is almost always a question with one-worded answer. Then the stations would be like station to give information, to gather information, to talk to a partner, to talk to a relative, something like that. Then once one mocky station is finished, you will be taken on to the next mocky station. So that's it with regard to the exam format in psychiatry.
That's a very important question which most of the students are unaware of. The components of the surgery exam. Basically, there is a theory component as well as a practical component. The theory component has an MCQ paper with 50 MCQs, and the duration is 2 hours. It has 20 true-false type questions and 30 SBA questions. And the SAQ paper has altogether 5 questions, and it should be completed within 3 hours. There are 2 questions from the general surgery, 1 question from urology, and the last 2 questions are from the subspecialties. These questions are again subdivided into 2 so that the student has to face questions from anesthesia, ENT, ophthalmology and orthopedics. And next we'll have a look at the practical components. Those are the long case, short case, OSCE and the surgery viva. In a long case, you'll be given a patient and we have to spend about 30 minutes with the patient, within which we have to take a complete history and do a complete physical examination. At the end of 30 minutes, you'll be directed to a waiting area where we spend about 10 minutes, during which we have to organize our history, make a summary and prepare the problem list and be ready with our plan of management. At the end of this 10 minutes, we'll be directed to the discussion panel, which consists of two examiners. The examiners can be both from the external examiners, or one can be an internal and the other can be an external examiner. During the discussion, you will be given 20 minutes, 10 minutes with each examiner. The first examiner will listen to your history and may question you regarding your history. And at the end of this 10 minutes, the second examiner will take over and he will question you on the management plan and on the theory and the relevant components of your long case. Next, we'll have a look at the short cases. In the surgery short case, each student will be allocated to two examiners. The examiners will take us around the short case stations. Here, each student will spend about 20 minutes, within which, according to the instructions given, the student will perform the short case and the student will be evaluated accordingly. Within this 20 minutes, a student would be able to perform at least 3 or 4 short cases. Now let's have a look at the OSCE. The surgery OSCE has 20 questions, altogether 20 minutes, 10 questions from surgery and 10 questions from pathology. In each station, the student will spend about 1 minute. This is a 1 or 2 word answer questions, which in case of surgery, the questions will be printed and given. In case of pathology, they will display some investigation results or any pathology samples. Next, the surgery viva. In a surgery viva, the student will be taken to 2 examiners, each examiner from different subspecialty. One of the examiner will be from anesthesiology and the other examiner may be from ENT, orthopedic or general surgery. With each examiner, the student will spend about 5 minutes. So altogether, 10 minutes will be spent on surgery viva.
Thank you guys. I hope you got a good idea about the examination format. Shall we move on to the next question?
Yes, Aki. This next question is from our junior batch. They want to know what they will be experiencing in the 3rd and 4th year clinicals and what is generally expected from them in these clinical appointments.
Yeah, that's a really good question and it's a very important question. And sorry, for final years you can't go back in time. So this will be really helpful for 3rd and 4th years. So this one is discussed by Nipuni, right?
Yes.
Yeah. So Nipuni, what do you think about that?
Yes, I think that's an important question because in the 3rd year, if I share about our experience during the clinical life, we had in the 3rd year the introductory clinical appointment and then we started our MSGOP appointments, which were 1 month appointments. MSGOP means medicine, surgery, gynops and pediatric appointments, and then we had our short appointments which included community medicine, forensic medicine and respiratory medicine, neurology and rheumatology, STD, dermatology, like that. We had several short appointments including pathology and family medicine which were about 1 month duration, and then we had our long clinical rotation which included 3 months medicine, 3 months surgery and then 1 month for pediatrics, gynops and psychiatry. Then after finishing all that we go to the professorial unit. So with regard to the third and fourth years, I think some of you might not know about the casualties, which is very important, because a casualty day is the day where the new patients are being admitted into the wards. So when you go to the ward will be flooded with new patients. There will be variety of patients. So we had clinicals in the morning, and then in the evening we have our lectures, and then during those casualty days you will have to go back to wards after finishing the lectures. Then we stayed in the wards until about 8 o'clock in the night.
Yeah, Nipuni,
Yes.
I must say that for our juniors, that format will be different, right?
Yeah.
So because of that COVID situation, they won't have the lectures in the evening, so they will have the whole day clinicals. Am I right?
Yes.
Yeah.
But the duration of clinical studies will be the same for everyone. So what I wanted to say was, as a group of students who are in the third and fourth years, who have just started their clinical life, and as a group of people who have plenty of time before their final exam, they are the ideal people who can get the best use of the clinical appointments and the casualties. So I want you to go to the casualty wards and do the ward procedures, improve your practical skills, and please don't cut clinicals, and please attend and get used to that. And also there was a problem that everyone asked about the pre-clinicals, the importance of pre-clinicals and para-clinicals during the final year. So if you have done well during your first 2 years, if you have a good result, and if your base is good, it will certainly be a good thing for your final year result and your clinical works. But those who haven't done well during your first 2 years, please don't worry, because you still have time and you can do well in your exam, because I have plenty of my colleagues, examples, who have not done well in their previous 2 years but done a good job and has achieved a great results during the final examination. So you still have got time. Even the final years, you have 4 appointments left. So you all have time. So if you have the courage and if you have a plan, I'm sure you all can do well in your clinicals in the exam. And regarding the third and fourth years, a third year should master the history taking and examination techniques. We expect only that from them. But in the fourth year, you have to go a step ahead of the third year, because you have to do some mental work there. So if you are doing an examination, not just the examination, think of what could be the diagnosis and work out what should be the next clinical sign I'm going to elicit. So do that thing constantly, then at the end of the day, at the final examination, it will come spontaneously from you. So that's all I have to tell. Please don't use shortcuts. Examine all your patients, take all the histories, and have any structure which will train you to the final examination to perform well.
Yeah. Thank you, Nipuni.
I think that's a very good account on these third and fourth year clinicals, but I think Nelum is willing to add something more to it regarding how this first and second years would affect the first and second year clinicals would affect your final years. I think Nelum is a good example.
Yeah. Thank you, Sarah. So I really wanted to say this to you guys. During my first pre-clinicals, I did not do well. I had 3 repeats. I got 3 modules repeated. my very first module, the foundation and the locomotion module, and my endocrine module. So I got repeated those 3. And during that time I was so depressed. I felt like, oh my God, whether I'm not suitable for this medical field. So, however, I just hang on there, and when we started clinical, I found it's just interested. Clinical is interested. It's so different from the pre-clinicals. Though I didn't do well in the pre-clinicals, it's good you have the basis. I must say, you need to have a good basis. But even though you did not perform well during your pre-clinicals, once you started the clinicals, you will find that it's more interesting. So I just started doing my clinicals very happily. I must say that I just did very happily my clinicals. But still, I did not get that motivation to go read everything, study well, work hard. I didn't get the motivation. So once I come to the professorial unit, my first professorial appointment was medicine. So once I finished the medicine, I was just, that also I did to, let's say like surviving, to survive the professorial appointment. I did that appointment. Once I finished the medicine appointment, I realized what I'm doing. I'm not going to save any patients if I work like that. Definitely I'm going to kill some patients. So I just started to think, I must study work, I must work hard, I must work smartly to learn the things here so I can save a patient one day. That should be your motivation. That was my motivation. So I started work hard. I asked questions from consultant. I just kept my shyness aside and I asked my questions from my consultants, and I volunteered everything I can do. So we did a good job. I had a best clinical group in our batch. So we did, together we did a very good job. So my advice is, don't think about your past exam results. It won't matter. You just need to, this is for the final years. So you have finished your first professorial appointment. I have started my doing work hard and smart after my first professorial appointment. You have to work hard. You have to talk to your consultant. They are so willing to help you guys. They are so happy if you ask questions, if you have volunteered everything in your clinical career. They will be so happy. They are the best teachers. We have the best teachers in our faculty. So they will teach you, they will guide you, they will correct you. So this is a good opportunity. My advice is talk to the consultant, get clear your doubts and all the things. Don't think your question is stupid. Every question is a good question. Okay. So, and get involved with the clinical practice. I never cut clinicals during my professorial appointment, and also attend to the ward classes. The ward classes are the things that they are going to ask during your clinical exam. So that will be really helpful. So identify what are your weak points. When I look back, I identified my the weakest point was I couldn't write SAQs very well. So I just wrote SAQs and get corrected from the consultant. So with that, identify the weak point of view. It is only can done by you guys, because you know yourself well. So with those things, you can have plenty of time. You can get through this thing. So don't think about the past exam results, and the people who did well during past exam, don't think that you will get through this exam also as you did pass. You have to also work hard at the same time. So that's my advice.
Thank you, Nalum. That was such an inspirational and a motivational story. So let's move on to the next question.
So I don't think no one would argue with the fact that the final examination is invariably the toughest examination in our med school. And it is the basis of our future medical career. So obviously for that, the final professorial appointment, all the professorial appointments matter a lot. So my question is, what is the format of the professorial appointments? So how it is being carried out, and what are being expected from those appointments?
Yes, I think Dinuka, final year is a very crucial year, and the most important thing is it will be very stressful, and then you have to face whatever that comes your way. So I think let's talk about each and every appointment separately. So we have Sunet and Metmal, Dulini, Hansini and Vihanga, who will be explaining about these things.
Okay, I will talk about the medicine professorial appointment. First, I will talk about the basic structure of the professorial appointment, and then I will give a brief introduction how to work during the appointment. For medicine, you will get a 7 weeks appointment, which includes 1 week in PCU, and 1 week to be trained as a training housing officer, THO period. And there will be a separate roster for vinipuncture. During this appointment, the whole group will be divided into cubicles, where there are separate consultants allocated as A, B, C, D. The patients you get are from each cubicle. So you divide the patients in each cubicle and get ready to discuss those patients in the morning ward rounds. When you take histories, it is important to see each and every patient as an exam case and try to get timed histories rather than taking irrelevant histories. Plus, try to discuss those cases with your consultants, registrars, and among your colleagues. And in each day, usually there will be a morning ward class which will be taken on a patient. In these classes, you are get to present the histories and do short cases as well. So use those valuable opportunities to train yourself and build up the confidence. Plus, in the evening, usually there will be a separate class taken by a consultant. On those ward classes, remember to either record it or note down the important things so that you can build up your own notes at the end. During the appointment, you are supposed to complete 2 case reports, which will be given marks in the final examination as well. On top of that, during the PCU appointment, you will have to complete the emergencies you have seen and make a document. Plus, as we are dealing with patients, how you are dealing with patients will be assessed by taking the feedbacks from patients. Therefore, be as nice as possible to your patient and kind and caring. And I will highlight some important things that I personally think that would make an effective appointment. That you should take histories thinking as examination cases, plus try to take the histories timed, because it is the best training you can have to prepare for the examination. Other thing is taking opportunities to present the cases. Try to present cases to your consultants. This will be done during your ward rounds. Plus, you can have a study group within the group where you take histories from different patients and present to each other and try to build up a discussion, because majority of your marks will be scored by giving answers orally in the exam. So it is important to practice discussing a patient. On top of that, regarding short cases, try to examine in the exam format in a time way to get to build up the confidence on examining the patients, because at the exam you are basically acting at a reflex level. You can by heart and do. What you do in the examination will be what you have really done in the boards. Therefore, do it in do short cases in the exam format even during the appointment itself. The other important thing that to revise the long cases and short cases, you should build up your own notes by getting information from ward classes plus the recommended textbooks, because those will be important when you go to exam and prepare for the exam. In addition to that, try to complete all your lecture notes and the short case and long case notes within the appointment, because after you cannot revise all of that or complete the notes during the study leave, and try to complete those notes within the appointment itself. I think that is all I have to tell about the medicine appointment. I will hand over to Vihanka.
Yes, thank you, Sunit. So Sunit talked about the medicine appointment, and I will be just giving a brief introduction to the pediatric appointment. So I think the pediatric appointment was actually very enjoyable for me. The main fact is that it was very organized, because on the first day itself, the head of the department sat us all down and gave a very thorough introduction to what is expected from us from the appointment and what the appointment will be like. So just to give kind of a brief, just to briefly describe what happens in the ward, the professorial unit has two sections, an A side and B side. The B side is like any other general pediatric ward, but the specialty of the A side is that apart from the general side, it also has a nephrology side. So we all have to divide into groups and rotate among ourselves between these. So just to tell a bit about a typical day in the pediatric ward, in the mornings we attend ward rounds with the attending clinician, and we have to present our histories. The most important thing in pediatrics is that everybody should know everything about every patient. So they encourage us to do something called student ward rounds in the evenings. So we have to go around the ward and see patients, and the owner describes their experiences with the patient, the history, and any important things about the patient. So in that way we know at least briefly about each and every patient. So during this morning time, some people may also visit clinics, and there's also a big proportion of neonatology that is incorporated. So we have a very wide sort of experiences we gain through the appointment. And after this morning period from 11 to 12, the whole group gets a class. And then after the interval from 2 to 4 also, either we get a class or some people may have to attend clinics. So after this, after 4 p.m., we are encouraged to do student-generated learning and go on student ward rounds. And I think that was one of the most important time periods for us in terms of learning by ourselves. And talking about casualties, it's a bit hectic, because one group has a casualty every other day, and also the weekend casualties are also like that. Every other week one group gets a casualty. Regarding what they expect from us, by the end of the appointment we have to make something called a portfolio, which has several components, but I'll just be describing the most important components. One of the main things is that we have to prepare 5 histories. They have to be very complete and thorough, with examination, investigations done, management, and follow-up till discharge. And apart from that, we also have to do something called mini clinical examinations.
So we are given a format and a marking scheme, and what we have to do is we have to perform in front of a colleague or a teacher, and they will be evaluating us and given marks. So this is just like a preliminary preparation for our short cases. Another thing is that we get a small student identity card which has a list of things for us to perform and observe and get them signed. And also there's a little section called the comment section where our teachers can give us remarks, either good or bad. So all these things come together in the in-course assessment, which is held, I think, the week before the last of the appointment, and we all have to face a long case, a short case, and a viva. I'm sure Parakram has described those things to you. So the long case and short case are just like, it's a very good opportunity for us because it's just like the exam. That experience is, I think, invaluable. Just to talk a bit about the viva, because we don't get it in the final MBBS, it's only in the in-course assessment. The viva, in the viva, we are divided into clinicians. And we present our portfolios to them, and they go through them and ask questions about the portfolio. And they also ask us questions about emergencies and any other knowledge in the ward. And collectively, we get a mark, and 20% from this in-course assessment, 20% of the final MBBS marks are allocated from this in-course assessment. So that's what happens in the appointment. Just to highlight a few points, we are encouraged during our kind of appointment to go to the Sirimau Bandaranayake Children's Hospital and see patients, because it has a lot of specialized units like the cardiology, neurology, and some patients we don't get to see in the professorial unit. So it's a must that we go and see those patients and take histories and observe them. Another thing is that I want to highlight is that the majority of things that are asked in the clinical pediatric examination, you can't get them from books. It's all mainly from experience, from observing. Like, for example, we were asked in our exam, like, what are the advices you would give to a mother of a baby who has a UTI or maybe febrile seizure. So it's obvious that you can't get those things from books. You have to listen to the interactions between doctors, and I think the appointment is the best place to do that, to just get all those information in. And the last point is that I know with the casualties it is a bit hectic, you have to work hard, but there is plenty of time to take extra histories, to examine more patients, to read by yourself and work together. There's ample time. But the important thing is, even though it's hard, at the end, I guarantee that it will be invaluable for you in your exam and in your life further. So that's all I have to talk about pediatrics. I think Metmal will be talking next.
Okay. I'm going to give an account on surgical appointment. Actually, we all know that all the professorial appointments are designed to fine-tune a student for the final exam, as well as to produce a good house officer. Therefore, we have to first identify the main aim of doing the professorial appointment, but that doesn't mean that you have to know all the things, all the clinical cases and short cases when you come to the final year. That is not the meaning of professorial unit, right? Then when doing an appointment, we have to know what are the components in each appointment. In surgery, there are multiple components, right? In surgery, we have ward work, then clinics, then we have endoscopy, theatre, and casualties, right? In each component, in each dedicated work, we have to mainly focus on special things, right? For an example, when you are in the ward, when you are engaging in the ward work, what we have to do is we have to take histories and examine patients and prepare management plans, as well as doing all the, apart from doing all those things, you have to study how a patient is prepared for surgery. That is the thing in surgery, and not like in medicine and surgery. We are extensively questioned in the exam about patient preparation, post-operative management and all those things. Therefore, in surgery, the ward learning is not limited to take the history and present, and you have to extensively concentrate on patient preparation and post-operative follow-up. Now, there is an important thing I have to tell, right? When you are doing ward work, try to learn patient preparation at that time, right? Most of the students are doing this thing. I think that is a mistake, right? We can't learn patient preparation from books. Right? The best way to learn patient preparation is from the ward, from the patients, right? I used to maintain a separate book where all the patient preparations are mentioned from the time the patient get admitted until the patient is sent to the theatre. There are many patient preparation points, and that is very interesting to study those things in that manner. And I would like to advise to just maintain such a document and try to learn those things from the ward. That is about the ward work. In addition to take histories in the ward, it is very important to concentrate on the method of teaching of our clinical teachers, right? When they are teaching, they always try to make a decision with you. We have to concentrate on that, how a clinician make a decision on a patient, right? Mostly in SBA section of our MCQ paper, they give clinical cases and you have to come to a decision what is the best, right? That is mainly you can get the maximum benefit from ward classes and consultants how such a decision is made. That is the most practical way to learn that, because by reading 100 books you can't get that knowledge how a decision is made. That is you can get only from our consultants, right? Apart from listening and noting down, you have to always think how a decision is made after each ward class, get together and critically analyze how a decision is made by your teacher. Then we have clinics. Clinics are the ideal place to practice short cases, and we all know that we can practice short cases in clinics. But another important thing we have to focus in clinics, right? We know that some patients, especially in surgery, are followed up long term, right? For an example, a patient with colonic cancer. Now, when you are in the clinic, you have to not just focus on short cases, but always try to focus on such follow-up patients also. How actually a patient is followed up. What are the actual follow-up steps? What are the most crucial steps? Then those things are definitely questioned in your final exam. Unless you have done it and you have witnessed it, you will not be able to successfully answer such a question. Then we have theatres. Theatres are actually there is a mistake. That was a mistake we all done. Right? We thought that theatres are just to stand and observe surgeries, but the main purpose of attending theatre is not that. You have to start your learning in the theatre from the immediate pre-operative patient preparation, from the checklist. Actually, for our level, the operative checklist is very important, but we all miss that. Right? Then how a patient is positioned, how intraoperative complications are managed, what are the special precautions taken during the operation, how to ligate vessels. There are some points that are questioned at our level also, especially in thyroid surgeries. There are some questions that are questioned from us during the final examination. Therefore, at the theatre, you have to focus on those things. In the endoscopy room, don't go there and just observe and watch the teledrama like on the screen. Don't look at that, and please don't concentrate on that, and try to observe how the patient is prepared, how the patient is prepared, how the patient is positioned, what are the special precautions taken, as I mentioned before. And post-operatively, how a patient is mentioned, how the patient is being sent to the ward, what are the special advices they give. Those are the things that are questioned from us, especially. We are not extensively questioned about the procedures, about how the endoscopy is inserted, and all those things. Those are also important, but at our level we have to concentrate on the things I mentioned, right? Then we have casualties. That is very important. We think that in surgery the casualties may be a bit light thing, but to learn actual emergencies and for an example, how bleeding is managed, you have to attend actively to casualty sessions. You have to actively engage in patient management also, and if you are willing to do that, there are a number of opportunities to do so, right? But the thing is that when we are inactive, no one is coming behind and asks us to engage in clinical activities. Therefore, my advice is to actively engage in clinical works, not only with the casualties, all the ward works, theatre procedures, and all those things. Those are the main components in the surgical appointment. During the learning, I want to highlight this point. During your professional appointment, when you are learning in the surgery, always try to concentrate on clinical teaching. What are the special areas that are highlighted by our clinicians? By knowing that, you can build up a good plan for your further studies. I mainly focused on final year students, but considering third year and fourth year students, if you can start your journey in surgery from the third year, that is the best thing that you can do, because there are a number of cases we have to examine. There are a variety of long cases, short cases, theatre cases, and all those things. If you are very interested, you can actively engage during your clinical time. In third year, you have 4 hours per day. So that is not a very long time period. During that 4 hours, you have to actively engage and come to your residence place and revise them. And those are the basic advices that I have to give. Then what I did was, I had a separate document to note down things that I have learned outside the regular teaching. When I see something interesting, I note it down as a clinical diary. I maintained it. That helped me a lot when I faced the clinical exam, especially in vivas and practical sessions. And those are the things. Then finally, please be dedicated to the work. Whether you are starting from now, that is more than enough to get a good result. That is all depending on your dedication.
Yes, finally appointments, clinical appointments, how to do this. A very important question we have raised. In third year and fourth year also you have appointments, but I'm going to mainly concern on the final year with prof appointments, because I think it's the most important appointment that you get. Now I did my GMOX appointment as my first prof appointment, so I got 8 weeks, but then it changed to 7 weeks. So I don't know what time will you get, because this is a difficult situation. So you may get 7 weeks, sometimes 6 weeks. So, doesn't matter what time you get, it's very important to use that time, even small duration, beneficial. So now you have to work during the appointment. You have to work in the gyn ward, ops ward, labor ward, and theatre. Some days you have to work as a TH. So during ward work, I mean ops ward and gyn ward, you have to take the histories and do the examination. So in the ward round, you will be questions about those things. In our group, actually, we took the histories and presented with the consultant as well. We presented among our colleagues, friends. That's also very important. If you have time, you can do. Actually, that's a great opportunity that we got present to the consultants. to during the time frame also you got opportunity to present, so that's so important. And please do not cut clinicals, and please be volunteers. Now you may laugh at me, but at the end of the appointments during the study leave, you may realize how important is this practicing. It's really important. Initially, you don't have to take the histories within 20 minutes. Just try, but gradually you build up the time frame. Okay, don't forget the time frame also. And as I said before, examination and history taking, presenting to your friends is very important. And now you take histories allocated to your patients definitely, and try to take other cases, especially exam cases. For example, abnormal uterine bleeding. Many of the students in the exam, we got abnormal uterine bleeding, lambda valva, those two. These fertility, these cases are not that much, not very rare, but and these abnormal cervical smear, these things are not that common. So please practice the common cases during the appointment. And about the ward classes, you take notes of the ward classes. That's what I did. Then you can go for more hostels. Then you can read the relevant textbooks or lecture notes, and you can fill the gaps. It's better to adhere to one note actually. No point of taking many for a particular topic. No point of keeping many notes, because in the study leave you are not. You don't have that much time to go through many notes for one topic. So that is the most important thing I learned during my study leave. And what I did was, I kept Madam's books as my major note, but I made short notes, like flowcharts. So when I do MCQs and SAQs, I refer those notes, and then I refer the textbooks also. So you can allocate to one note. You can take one note, and during the ward classes, you can add additional points to that note. And actually, in my point of view, during these appointments, you should work hard to understand things, understand basics mainly, and understand everything, not to remember and by heart things. You should prepare for the study leave during the appointments, because you get the study leave. It may be 4 or 5 weeks, that less amount, but it's better to prepare for the study leave. Take the notes, prepare the notes, and understand everything. So I think that's more important.
With regard to the final year appointment in psychiatry, the duration would be 5 weeks, as you all know, and during each week you will be allocated to a consultant, and then you will be attending the ward rounds of that consultant with the histories. So I found the ward rounds to be very important, not just for the clinicals but also for the MCQ component. Then in the morning you also have the ECT and shadow HO period, time allocated for ward work and for day center. During the shadow HO period you will see what type of patients should get admitted and what type of patients can be managed as an outpatient and how they are referred. During your discussion of the long case, you will find that it's extremely important to know this stuff, because you should know the treatment setting. Then with regard to the ward work period, what we used to do was, we went through the drug trolley, the tablet strengths, the type of the tablet, whether it's a tablet or a capsule, and those stuff. We got photographs and wrote down the drugs and the doses, and I personally prepared a chart with the conditions and the drug and the doses for each of the condition. Then and also during the ward work period you can go through the DHDs. You will find that the management differ from one patient to another. Go through their drug charts, and you will see some drugs are given in the morning, some are given in the night time, and like when you are giving an answer when you are asked about a medication, you should mention the name of the medication, the dose and the time which it is given. So what we did was, we went through the BHDs, we wrote down the drug charts and the condition the patient is having. And also like have a history for each and every condition, like if possible, because you can go through them just prior to your long case. Then most of our colleagues had gotten anxiety disorders as their long cases. So you'll see that those are not very common in the ward setup. So what you can do is, you can go to the day center. There are plenty of patients with like OCD, specific phobia, social phobia. So you can just talk to them. You'll see what type of history you should get. And then there are clinics, like there's the child psychiatric clinic. You will see how the children are getting managed. That, as an example, ADHD children they will bring like two types of documents: the behavior of the child at home and the behavior of child at the school. So you will see how they are getting managed, how they are getting referred. And then the ward classes, which will be conducted at the department. For me, I myself found the ward classes to be extremely important, not just for my clinicals but for my SAQs as well. So always write down the stuff you have been taught on and read on that, and always try to present your cases to a consultant. Yeah, that's a very beneficial experience. And then with regard to the ICD-10 criteria and referring Hungwalla book and the Oxford book, whenever you get free time during your appointment, read through the Hungwalla book, like try to know it in and out. It doesn't hurt like to have gone through it at least 3-4 times maybe. Then ICD-10 criteria have a short note for each and every criteria. You anyway have to by heart them, try to do that way. And yeah, that's all I have got to say regarding preparation for your prof appointment.
In addition to surgery, I will be talking about anesthesiology appointment. Now, the knowledge on anesthesia will be mainly assessed during surgical professorial final exam. When you are doing anesthesia appointment, that is very interesting appointment. You can learn a lot, right? You can revise a lot and you can sum up what you have learned during medicine, surgery, gyn and obs, and these basic appointments. When you are doing anesthesia, mainly you have to focus on especially anesthesia and emergency management, as well as managing critical ill patients. There is very structured teaching method and practical sessions during the anesthesia appointment. You have to actively engage in these activities because it is all about practicals. You can't learn those practicals definitely from books, right? Then from this level, try to participate all those activities. By learning that, you can apply that knowledge to your surgical subjects, medicine, gyn and obs, and pediatrics and all. Right? During the appointment, there are practical sessions as well as separate session for clinical teaching. At the end of the appointment, there is a in-course assessment which you have to pass to face the final exam. That is general idea about the anesthesia appointment. Whenever you are doing a subject which is very practical, try to actively engage in clinical work and learn from them. Don't sit and read books top to bottom to learn those things. And thank you.
Right, thank you guys. That was a really good explanation for our juniors. So let's move on to the next question. Yes, Ronari, what is the next question?
This question, Aki, this is one of the questions that many of us have. because this is about which textbooks to use, because there's an overwhelming amount of textbooks around and we don't know what is the best one for this subject and like that. So what do you think, Aki, like for each subject, what are the textbooks that we should use as reference?
Yeah, that's an important question because most of us had that confusion during our clinicals. So Metmal will give you a good account about that. Let's get started with Metmal. So Metmal, what do you think about that question?
Okay. Now, when we are going through this clinical journey, we can see there are a number of books, number of valuable books, but we can't read all those books. Therefore, our faculty gives us a recommended books, a list of recommended books. Now, before going into details about that, now we have to identify what is a reference and recommended reading. Now, we are not usually read all the parts in the reference text because sometimes we all know that reference books are very big books, right, with very fine details. When we are studying a part, right, when we are reading a basic textbook, if we made a question and area which is not very clearly mentioned, we can go to the reference book and read and understand the basic idea about that. That is how you can use those books. Now, when we are concentrating on each subject, for medicine, we have Moore and Clark. For surgery, we have illustrated textbook of Pediatrics, so the so-called Sunflower. For gynobs, we use 10 teachers gynecology and obstetric books. And for psychiatry, we read shorter textbook of psychiatry, Oxford shorter text. And for surgery, the recommended reading is Bailey and Love.
Yeah, Metmal, I think you missed something, the illustrated book for pediatrics, right?
Yes, that is the Sunflower. Okay, those are the basic textbooks that we have to read, but when we are in this learning process, the main resource is the patient. This is then we are producing doctors, right? Therefore, we have to learn from patients. Then we all were thought about that, but sometimes we were not be able to extract what was said to us. Actually, now we realize that actually patient is the best teacher. That is the best study material, and always concentrate on patient-based learning, especially if you are in the final year. When you are in the third year and fourth year, you can study, you can read books and lecture notes and all those things. Even when you are in the final year, always try to learn with the patient-centered basis. The other thing is lecture notes and clinical teaching. When you are making a study material for you, that is the best way, and you can make one for you which is very suitable for you. You can guide either clinical teaching or a lecture note as the frame of your knowledge basis, right? To that you can add some important points that you realize that this is important during your clinical appointment. Then you can maintain separate document for each case. In every subject, we think that we collaboratively think that is very important to study when you are preparing for final exam. And apart from this recommended reading books, reference books, lecture notes and clinical teaching, in our library there are a number of books with questions. To practice in the exam, mainly we are assessed by questions, right? When you are going to the exam, you have to practice them and prepare for the exam. In our library there are very good recommended MCQ, SBA, extended matching questions, type questions for each and every subject. When you are study a specific part, try to master some questions regarding to that part. Then master your way of answering and extracting the key points of the question and come to a decision. And always when you are following guidelines, try to follow the recommended one from the department. And there are a number of guidelines which are produced by many countries and authorities. Therefore, always try to follow the recommended one from our faculty. Those are the basic idea about recommended reading and study materials. And when you are going through this journey, you may find that there are other ways also, and you can build up your knowledge. And that we can't teach you, and we can't explain what it is exactly. To know that, what you have to do is actively engage your clinical work and dedicate for the clinical work and your final exam. Thank you.
Yeah, I think that's a short and sweet account about the study material. So thank you, Mithmal, for giving that.
So let's move on to the next question.
So that was a very good account on the study materials. So yeah, true. Now we have Kumar and Clark's, we have illustrated textbooks, and we have Bailey and Love, everything. But the main practical issue we have in our final appointments is we don't have time. That is the main issue. So like, for an example, when we finish our clinical appointment for a day, in the afternoon after classes or casualties or whatever, we go home or we go to our residence halls, and then how to manage the time, how to plan everything, and how to study.
Yeah, I think that's a very subjective thing, because several people have several methods. So I think it's better to ask many people and get to know their experience, so that you will adopt your own way of studying. I think Parakrama, Vihanga, and
Sunet
and
and
Nipuni will be explaining about it.
Okay, thank you, Asara. So, how to study for the clinical exam? I think you should have main two aspects while studying. One thing, you should have planned for the day, and also while doing your clinical appointments, you should have planned for the appointment. So I will first explain about the how you should have plan your day. So there should be a particular time for your daily habits, like when you wake and when you sleep, when to eat, when to study, like that. I personally, after waking up early in the morning, then go to the wards. And while you are in the wards, it's not appropriate to try to read books, but to see patients as many as you can in a meaningful way. What I mean by meaningful way is there are important patients. So they are the patients that where it is possible to get in the exam. So you should see how they have presented, what are the investigations done to them, how they have managed in the ward, and there are physical signs that you should be familiar with, like that. You should actively engage in the clinical work, seeing the patients, and don't try to read books inside the wards. But you can read around your patients, just take about 5 minutes, a short period of time, and read something about the patient. And then after going to a residence, you can flashback about the patients that you saw during your day, and read around them and make some note about the condition that those patients had. And also the evening and night time you can plan to do the previous questions, the essay questions, and also the MCQ questions, and you can spend that time for the reading. And also I think according to that, you can have your own method, and you should have a plan for your day as a habit. And also before starting the appointment, to plan the appointment, first you should go through the curriculum. Usually the department gives you the curriculum at the beginning of the appointment, then make a list of topics that you have to cover during the appointment. And each day you should try to cover each topic. I think what I personally did was under each topic I think how this can be asked in the exam, whether as a long case, short case, as a essay question or a MCQ question, and study that topic targeting those questions. So I can give you examples also. For example, if you study hypertension, then it can be asked in a long case and also as a essay question, and usually it is asked as a single best answer question. Then like that you can target those areas and study the particular topic according to that. Then try to cover as much as all the possible topics. You may not be able to cover all the things, but then you know what you have to study, which you have missed and which you have covered. And also I want to emphasize that how to remember the things that you study. As human beings, it is our nature to forget things. After we read something, in about a few days we forget what we have read. So it is important to refresh what we have read. So there's a technique called spaced repetition. So I recommend you to search what is spaced repetition on the internet, and there are enough YouTube videos. There's a YouTube channel done by Dr. Ali Abdal, who is a lecturer at Oxford Medical School, and he has done videos from his medical school days which are very helpful. So he describes many study methods that you can use to remember things and to how to do well in the exams. And also since this is a clinical exam, practice is the one which will give you a good mark. So you for example, the examination techniques, during short cases you don't have time to think and to organize your thoughts and do that thing. It is a reflex at the exam, so you should practice again and again, as there's a saying that practice makes you perfect. You should practice the long cases, short cases again and again, then you can do the clinical exam set. I think my other colleagues also have their own personal experience about how to study. Thank you.
Yes, Parag, you mentioned most of it. Yeah, and I will share my experience, what I learned by doing the final examination. Basically, what I did was, during the appointment time, during working hours, I basically engaged mainly in the clinical learning, and I tried to take histories as much as possible in a timed manner and discussed with my learning buddies. And we tried to mimic the long case scenarios as which is there in the exam, and we presented in a timed manner and we discussed it in a timed manner. It was really, really helpful during the long cases in the actual exam. Plus, we went to see important short cases in the board and with our friends, and we presented to each other. It was also very helpful. Plus, when we get an interested patient or an important patient, I used to read around the patient then and there, so that I can really work out the pathology, what has been going on this patient, what is the basis of each symptom. Likewise, and I went through the ward management, what investigation have they done and how are they managing, and I added to the end of my history what are the investigation they have done and what are the results and what is the ward management. And when it comes to exam, it was really helpful to revise me, because I read, for example, if I take my acute coronary syndrome patient, a heart attack patient, I have a separate note which gives account on theory, the lecture note, plus the material from textbooks, which have I made a complete theory note for heart attack, stroke, or myocardial infarction. On top of that, I had a separate my own note how to take the history and what are the important physical findings that I would expect I need to look in a heart attack patient, and what are the investigations and how are we going to manage. So that note set I maintained throughout my third year, fourth year and final year. So at the end of the final year, you will have a very refined note set on the theory parts of the heart attack, how to take a good history from a heart attack patient, plus what are the investigations and management which is done in the ward. That was really helpful to me during the long cases. So I recommend you to do that also. On top of that, after the clinical working time, I used to discuss questions and do model papers with my studying buddies before going to the halls. So it was really helpful because we are really tired usually be tired after doing clinicals. So that time period was really helpful to get the maximum out of the time. Discussions we had with the colleagues. And when I go to my hall, I used to refer the reference books regarding the patients I saw in the ward, because in the clinical exam also what you get in the exam are the patients in the ward. So if you have read around and understand the basic pathology, management, everything, you will be at really advantage at the exam. The other important thing that I had my targets for each week, like in this week in medicine appointment I would cover these topics and try to cover these examination points. Likewise, I had targets for weeks and I tried my best to cover the appointment, the subject within the appointment itself. So it is really important because study leave, we can't rely on study leave to see the lecture notes or go through lecture notes, fresh lecture notes. So you have to go through them and complete the lecture notes so that you will be at really good point to start the study with. Another important point is that having a short note, a concise note, because in the theory part, usually the theory examination will be held within a stretch. For each 5 days you will get 5 subjects. At that point you cannot go through extensive notes. So you have to have a concise note, a brief note about the topic, which you can refer and refresh your knowledge. So that was really helpful to me in the exam. So I would recommend you to do that also. I think that's all I have to say. I will hand over to Nipuni.
Thank you, Sunit. As Parakram and Sunit explained well, they said most of the things, and I guess I also had some good habits which helped me to come to where I am today, and I had some bad habits too. Anyway, I will share my experience with you that you can build up your own study method through taking into account all of our experiences. So regarding the clinical work, I would recommend you to do your ward work maximally because starting from the ward rounds, I had a separate book to write all the things our teachers taught us during ward rounds, which were very helpful for even our MCQs and also for SAQs sometimes, because they are the ones who make the papers, MCQs, SAQs, all. So we can get an idea what they expect from us, because there's a whole lot of things to study, and they will guide you through which you have to go, through which path you have to go. So I would recommend, if you can, it's better keep a note for your board rounds, and then get as much as word classes from your teachers, because they were very helpful, but don't use that bad habit of recording the word classes and listening to them again at a later time and rewriting, because at the final year you won't have time to waste like that. So write, if you want to write, write then and there, and have a CR book for word classes separately. That would be a very valuable thing for you when you are preparing for your exam. And then when you get a patient, take the complete history and do the examinations, and then have a habit to write the summary and problem list and plan the investigations and a basic management plan for your patient. Because at the exam you have to do all that, but if you have not practiced to do that, you will struggle to do that during the exam. So please get used to write a summary, problem list and investigations and management at each history, end of each history. And then regarding the history taking, I always try to think about the differential diagnosis by myself before looking into the BHD. So I would like to encourage you to do the same, because it's good that if you have a template or something which has been made by yourself, but please practice to think, because in the exam you will have a short time, and if you go in a wrong direction, there will be no coming back, because you have spent some time on that. Therefore, at the beginning, very beginning, you have to decide what the patient has got. So for that, it's all right if you examine a little bit at the beginning also. So have a habit to get into at least 2 differentials at the beginning of your history. For that you have to practice, because you can't do that in the exam. So please practice to coming into diagnosis while taking the history, and practice examining a patient while taking the history too, because that would be very important in your final exam, because you have a short period, you have to take the history and you have to examine as well. So practice that also. Then after going to the hostel, usually I used to study at nights. So if you have a set time to study, I think you won't feel sleepy. I mean, if you have practiced that for a long period of time, then that won't be a problem. I did not have a problem to stay awake at nights, because I have been practicing that from the 3rd year onwards. I didn't work much during my first 2 years, but from 3rd year onwards, I had some kind of a plan to do how to study. So I worked at nights. So after finishing the clinicals and going to the hostels, you take some time, some rest, and then start your work. Reading around the patient, and what have you got, what you have learned new, you have to refer, and also the lecture notes. So have a fixed time to study, and also finally I want to say, as Parakram and Suneth also said, have a plan for the day. At least once you go to the hostel, take a piece of paper and write what are you going to do tonight. So then you will efficiently do your work. Unless you do that, you will do here and there, but nothing will be covered. So have a list of long cases, have a list of short cases that you have to cover, and tick them and do one by one. So then it will be a blessing when you face to the examination, because once you have completed it once, it will be easier for you to refresh the memory. So that's all I have to tell. I'll hand over to Vihanga.
Thanks, Nipuni. So I think Parakrama, So Neth and Nipuni all described most of the things. I'll just touch upon some of the things from my experience. I think one thing that wasn't really touched was I think this is a problem for a lot of people, whether to actually during an appointment, whether you concentrate on that appointment itself or should you revise other things as well. So personally, I didn't actually really have time to revise anything else because of the workload. But I think looking back, if like on the weekdays, if you could concentrate on that subject, whatever the appointment you do, and in the weekends, if you have time, if you can kind of revise the other appointments you have previously done, and not the ones you are going to do, but the ones previously done, I think that would be an ideal setup. But there's no hard and fast rule. It differs from person to person. And if you're not comfortable and if you think you don't have time to do other subjects within the appointment, that's also totally fine. And so you can, as they said, you can make a study plan and you can do all those things. And another problem I think I had, this was actually a big problem, is that unlike Nipuni, I used to fall asleep all the time. And I think the thing that worked most for me is staying in the ward, because when I saw a bed, I think I just wanted to sleep. So if I go home or to the hostel or wherever, I used to fall asleep. So the best thing is to go to the ward or stay at the pillared area or any other place in the faculty and do your work. And if you, by any chance, if you are falling asleep, the best thing is to not study but do some kind of other writing activities, like doing like model papers or SCQs or something like that. And the other thing I want to highlight is that they all said it, that we have to have a note by ourselves. And one of the mistakes I also did during the appointments were to record things and thinking that I will write them down later, but just I didn't have any time to actually go through any of them, and they weren't in my head either. So I think what Nipuni suggested was actually really good, to write it then and there in clear format so you can like revise it again. So the last thing I actually want to say is that it doesn't matter if you haven't done it already. You can start now. You can definitely get to a good result if you start now. And don't overwork yourself, don't overstress. This is just another exam. You just have to work a bit harder, but you can definitely get there. So just develop your confidence in that, and you can definitely get to where everybody else has already got and where we are today. So I'd like to wish you all the best for that. Thank you.
Yes, study methods. Most of our Angilas and Mayas ask about these study methods. Actually, I think Nangi and Maya study methods are individualized. You have to find the best study method, the way that suits you. Now, I have also tried many methods. Then I picked some methods that were beneficial. Then I tried those things. In my student life, in second MBBS, I just passed. But then I changed my study methods, and during third MBBS, I got second number. So I think study methods very important. You have to find the best one for you. During the study leave, the main thing I did was writing MCQ explanations, MCQ Vivarana. In my A-levels also I did the same thing. Mainly in final year study leave, I did this writing MCQ explanations. For example, I get an MCQ and try it first. Mostly during study leave also, you can't answer all the things. You're not full of everything. So then I refer to textbook or lecture note. Then I clarify all the answers, and I don't actually stick to that particular MCQ. I read the whole, not the chapter, but the main topic, around the topic. So I think that was very beneficial for me. SAQs, I didn't practice much. I did, but only the main things. I didn't have much time for that because the main thing I did was writing MCQ explanations. That was good for SAQs also because you cover many things. About the clinical examination, I got together with my friend and I practice examination, especially presentation. Now I have allocated some days for gym and notes. So during those days, definitely at night, I did examination and presentation. It's very important, I think.
Okay, study method. Like you can't pinpoint and say this method would be the best thing to do, but do what's best for you. It will be like working individually or working as a group, but do what's best for you. For me, I studied individually, but during the appointment and also for the MCQ discussions, I did it as a group. Halfway through our second prof appointment, we had the time out for COVID, and at that time I had a lot of catching up to do with my lecture notes and textbooks and MCQs. That time period was like a blessing for me. I completed like a lot of work during that time, and I never missed an online lecture. So right now you can use this time very effectively. And for the MCQ discussions, what we did was we had a WhatsApp group, and we would allocate questions for each and everyone and would discuss those questions like taking 2 hours per day like that. Then rather than doing MCQs alone, when you do the MCQs as a group, you see other people's perspective. If you do it alone, you will get biased. So do MCQs as a group, complete the MCQs beforehand, and use the time you have now very effectively, and study methods like always remember stuff using connections. Always connect one fact to another. It will be like in the same subject or in between subjects, that doesn't matter, but like connect facts, like it will make your life very easier. So yeah, that's all I got to say. Textbooks are the key when you are preparing for the MCQs. Yeah, that's it. Yeah.
What's the next question, Ronald?
Aki, now up to now we received a good idea about the study materials and developing a study plan during how to work during the appointments. But I think one of the important things is the method to manage the time effectively during the study leave. So what is your advice regarding that?
I think that's the most important thing of this session. How to get through the final exam. How the planning of the study leave will be the most important thing. And I must say, as a medical student, that will be the most stressful period in your life. Whether it is 10 weeks, whether it is 4 weeks, we can't say. That will depend on the time duration. But that period will be the most stressful period in your life. So you have to be prepared to face that. You can't escape that. So what are we going to do is our guys will give you some tips about that. So with that you can get some important points and to plan your study leave. And so guys, over to you.
Thank you, Nilu. While we consider how to study during the study leave, I think my colleagues will have different opinions from me because it is very personal. I personally studied 2 subjects in a day. For example, I study today morning medicine, then evening surgery, then next day morning pediatrics, and then general ops. Then the day after that I study psychiatry, and in the evening medicine. Like that, I used to study 2 subjects because while studying one subject during the whole day, I feel some kind of laziness during the latter part of the day, so I changed the subjects. While studying those subjects, it's better to have the topics pre-planned, which you have to cover during the particular day. And also you should have a plan how to revise them again. I will tell you example. For example, in medicine, if I study acute coronary syndrome today morning, then I have to revise it again. So the next day which I get for medicine, I first study the topic which I had planned previously. For example, I study pneumonia on the next day, and I prepare about 1 hour to revise what I have done previously. For example, I do the questions on acute coronary syndrome on the next day after studying the part which I have planned. I think you understand what I am saying, how I studied during the study, because if I take 2 subjects for a day, I repeatedly gets the same subjects once every other day or once every 3 days. So that's what the plan I personally had. I think my other colleagues also will have separate opinions. Better to hear those things also. Sunil?
Yes, Parakram. What I did was quite different from what you did. Actually, I studied in clustered. Like, I divided the subjects to each week. Like, usually I did according to the content, the bulk of the content. I did 2 days surgery, 2 days medicine, and other general psychiatry and pediatrics 1 day per each. So, which builds up to the week. And the other important thing I did was I pasted the calendar of the study leave, and I mentioned the number of days I have to the exam as a motivation. Otherwise, because at the beginning of the study leave, you are kind of less motivated and you think that you have enough time to go through all of this. But actually, in the practically, you get really stuck toward the latter part of the study leave. So it is important to always remind that the time you have is limited. So likewise, for that day, the particular day, allocated day, I would what I would do is I will cover each topic for theory component as well as the clinical component. Again, my previous example, if I study myocardial infarction or acute coronary syndrome, I would go through the theory note, I would go through the word classes I have written down and added to the note, and plus I will go through my self-prepared long case notes as well, so that I can organize the thoughts, and I would practice with sometimes I will practice with my roommates it as a long case itself. So because the ultimately in the long cases, what you score will be scored by telling the answer, not writing down. Therefore, it is important to practice with your roommate or colleagues at your hostels or home. The other important thing that you have to have plans, you have to have targets that I would cover these topics today itself. Somehow you have to do that. Like otherwise, because you will get more and more stuck toward the latter part of the study leave. And another important thing was that I spaced out a safe period from the day of the examination to cover up anything that I have missed or couldn't complete during the study leave at the beginning of the study leave. Because if we have missed something, that not having the confidence will affect negatively when you score. another thing that we have to other thing is that we have to prioritize things. There are some parts of the curriculum which are asked in the essay question, MCQs, multiple MCQs, short cases and long cases, and some parts are only asked in the MCQ. So you have to prioritize which note you have to read more thoroughly and get into your head. So what I did was I prioritize. I start the topics like 3 stars. It's very important. I have to put more time to that subject or that topic. Likewise, I prioritize the day according to the hours, according to the importance of the topic. Otherwise, you would have waste more time on very small topics, but not going thoroughly through the very important topics. Yeah, otherwise you will get stuck towards the latter part. So it was a basic message I wanted to give you, and try to do model MCQs and SAQs along with the theory part that you read. In that manner, you can master the art of examination. I will hand over to Nipun.
Thank you, Sunit. As Parakram and Sunit have already told, I also have my experience on how did I study during my study leave. So we had 10 weeks study leave, which is a huge time. If we waste, if we do not use it effectively, it would be a great waste of time. So I was also wondering what to do. Then I spent 1 or 2 days on organizing my study leave. So it was actually worked. It worked because I was a timetable person since the beginning. Even in the first 2 years, I did not study well. I was used to plan my study leave well. Even in the first and second years, when the study leave begins, I used to get all the lectures that has been done and the things we have to study, and I planned the study leave. So it worked. It worked to me. So I did the same thing for the final year study leave also, but it was a huge load of work. But I managed to make a plan which was a weekly based one. So for this week I will cover this. And I took all the things that has to be done, like lectures, long cases, short cases, because we had only a limited time before the clinical exam, and also there were some timetable issues also. So to withstand all that, we have to study clinicals also. So I took all the long cases, short cases and lectures, and then I made a plan for each week in the study leave to cover all the things, all the important areas at least. And then I started working. So it won't be a waste of time to spend 1 or 2 days on planning the study leave, because it won't. Yes, I agree, but I agree that how we have worked is the one which affect our results. But at the same time, you have to coordinate, you have to organize your study leave to get the best out of you. So for that, plan your study leave, what has to be done, and then you can follow it patiently. And also I want you to tell that don't get stressed out unnecessary, because then you won't be able to do the things you can do. So please don't be stressed. If you have an organized plan to follow, I think I was not much stressed during the study leave because of this organized way of doing my things. So have a plan for the next day. Make a plan for the next day at each night during the study leave. So then once you wake up in the morning, you won't be have to spend time on planning the day. So you already have planned it yesterday. So likewise, make a plan what to do in the day. And then regarding the subjects, a number of subjects you study, it is individualized. I also used to study 2 to 3 subjects per day because that was my practice since the beginning. I couldn't go on the same topic for a long time. So I used to do things mixed. I always took the mixed way. So I did 3 subjects per day, and also have a time to do examinations also. You can do imaginary examinations, especially pediatrics, surgery and medicine also. And as Sunet said, identify your weak points at the beginning of your exam study leave. So I felt when our study leave started, I felt that I was weak in surgery when compared to others. So I worked hard for that and others also. But when we are dividing our timetable, you have to work more on the areas which are difficult to you. So my plan has worked, and I have got good credits in surgery. So I think you can learn from all of us and make a plan for you. It's more, it will be beneficial, because don't try to apply our things to you, but you know yourself very well. So plan your study leave, not now, once it begins. So, and I want to tell you, you all can do well because you still have got time. So please work hard and have a goal. Be confident of your knowledge. You will achieve what you want to go, where you want to go. Good luck. And I'm handing over to Vihanga.
Thank you, Nipuni. So I think most of the things my colleagues talked about what you should do during a study leave. So from my experience, I'm just going to be talking a bit about what not to do during a study leave, because I personally think I didn't use the study leave to its best, I think. So I think my colleagues will agree that when the study leave is either too short or too long, both becomes counterproductive. Because I think we had 10 weeks of study leave, and I think a lot of people tended to burn out and stress out at the end. So what I would, I didn't particularly like stress out from the beginning, but I think one thing, my study method was I would take a chunk of one subject and I would study it all throughout the week, the same subject, and then in the next week I'd like switch it up with another subject. But what happened was, at the end of the second week, I would forget everything I studied in the previous week. So I think one way to just overcome that, if you're a person like me who can't multitask like them because they studied several subjects per day, I can't really do that. So if you're a person like me, I think what I would recommend is you take a day, you can study for the majority of time during that day, but you can separate out about 2 hours in that day, not to study, but to do like model papers and SAQs of the previous subject. I think mixing it up that way would be better rather than like for someone like me to study 2 things at once and get them jumbled up. So if you're a person like me, you can try doing that, because that was one of my weak points. Another thing that I want to highlight, because we had 10 weeks of study leave, I felt comfortable enough to actually start reading books. And I just like to highlight here that that was a very bad decision I took, because I started to read even the things I thought important, like important chapters. There were certain things that were not really at our level, not at undergraduate level, even within that chapter of whatever book I was reading. So I started to read from cover to cover and highlighting things because I had time, but actually I think it was not that productive. So I think the best way to read books is not in the study leave and it's during the period you work in the wards, or when you're doing some SAQs or model papers or MCQs, things like that, you can read. And otherwise, I think it's better not to read from beginning to end. Even the most important chapters, there may be things that are not important, so you can just get an idea about the important things when you work in the wards and when you look at the papers. So base your reading experiences with that in terms of context. And I think the last thing I have to say about the study leave is that you have to have adequate sleep and you can't get stressed out. You have to have good health, you can exercise and you can do all of those things. But if you stress out from the beginning and start reducing your hours of sleep from the beginning, you will definitely burn out by the end of the study leave. So I'm just encouraging you to relax, make a timetable as they said, and work efficiently, but don't overwork yourself too much. And don't worry about the exam that much, because it's like any other exam, just a bit harder as I said before. And definitely you can all get through it. So good luck again, and I hope you all do really well in your exams, and I know you all have the potential, and work hard, and I hope to meet you soon in our wards. Thanks.
And now let's see how to manage the study leave. The study leave period is very crucial because your results will be based on how you manage and plan your study leave. Before the study leave commences, collect all your notes, all your resources, organize your notes, and plan where you're going to study, how you're going to study, and with whom you're going to study. Some people prefer to study individually, some people prefer studying as a group, and some prefer to study in a mixed way. So, depending on your comfort, you plan your study leave. And during the study leave, don't experiment new things. Don't experiment any new ways of studying. You just stick to your routine way of studying. And during the study leave, you have to cover all 5 subjects. So, depending on the duration of your study leave, you have to plan it. And if the study leave is combined for both the theory part as well as for the practical part, then you have to work even hard. And divide your day into chunks and try to study at least 3 subjects every day. And always start your day with the hardest subject which you find less interested to, and always end your day with your most favorite subject because it keeps up your stamina and it keeps you boosted. And while you are studying, always take breaks and listen to what your body says. If you want rest, then do take it, take a nap, and eat healthy. And always keep yourself hydrated and motivated. Speak to your friends, speak to your family. Don't be so isolated, and don't be drowned in the study leave, and don't get yourself stressed. And stress management and anxiety management is so important in study leave, because each and every one of us will go through this, and each and every one of you will go through this phase of study leave. And it's And always remember, it's usual to forget things. Even we forgot things, we got stressed up, we got anxious. So it's very usual, and don't blame on yourself, and be with your friends, and always find a way to overcome this. If you are stressed, listen to some music, or do what you enjoy the most, or make a call and talk to your family. And it's wise if you can, it's better if you can make some short notes so that it can be used as a quick reference before you go for the exam. And even if you forget things, you just write it or include it in your short notes so that you can be updated before your exams. And during this COVID pandemic, most of us And now let's see how to practice long and short cases during the study leave. If you have time, you can go to the wards and see patients and practice. If not, especially during this COVID pandemic, we have restrictions to enter the wards. So in that case, and if you feel like it's consuming most of your time, then you can role play the long cases and short cases among your friends. For example, one of your friend can be a patient and you can be the student, and few other friends can be the examiners. So you can time and take the history, do the examination, and do the discussion among your friends. And every day practice short cases, because in the short case it's the technique that's more important than your diagnosis. So always practice short cases even during your studentship and as well as during your study leave among your friends.
So guys, we have reached the end of this our program. So I hope you got a very good idea about how to do the clinicals and how to do the final exam. I must say this is what we did was we just shared our experience to you. This is not the exact way to do the clinical exam, exact way to do the final exam. So what you need to do is you need to take the things out of these things that's suitable for you, and you have to find your own pathway to go through this clinical journey and the final MBBS exam. So hope this will be really helpful for you guys, and hope with these things you guys can gain more and make our mother PeMSAA proud. And the last thing I want to say is, please be dedicated to your work, dedicated to your clinicals, and be smart, work hard. You all will go through this exam. So good luck, wish you all the best.
We would like to thank PeMSAA and our faculty for organizing this event, and also we would like to thank our juniors who actively participated in this program. And in addition, we would like to thank our coordinators, Professor Tushara Kudagamana, Dr. Duminda Asaratna, and Dr. Ruwan Premathilaka for guiding us throughout this process, and the TRC for making this possible. And I hope that you gain something through this event. It was just as Nelum said, it was just an effort to share our experiences. There's no hard and fast rule in doing things. So we hope that you extracted the best out of it, and that you will adopt your own way of doing things. So thank you for joining with us, and good luck to